Aishe Ghosh, ఆవిడ చెప్పాను ఇందాక JNU Jawaharlal Nehru University Students Union former president. Now she is the present joint secretary of Student Federation of India. She will speak a few minutes.
First of all, I'm really privileged and honored to speak in front of you all. I'm a student, currently I'm a research scholar studying in Jawaharlal Nehru University. I'm doing my studies in international relations. But this is something I would like to I am really grateful that so many dignitaries, bureaucrats, expertise in the field of medicine and others like in media, everyone is having a discussion today, the civil society included, that what is actually impacting us in the medical field, privatization, how it's impacting us. Sir was mentioning something that caught me because I am doing education. I fight, I'm a part of a student organization which fights and struggles for better education for everyone, accessible education for everyone. Sir was mentioning that medical or healthcare has been commodified. I would just extend by saying that the problem inside our country is human lives are commodified. That's where the problem starts, that human lives of people are commodified. And hence everything related to human lives is commodified. Whether it's education, whether it's healthcare, whether it's food, everything that we see around us is commodified. Because basic human lives have been commodified. Why do I say this? Because we have recently gone through an pandemic. Recently, why I'm saying, like it's 4 years, 5 years down the lane, but we have seen something havoc. We have seen something maybe 50, 60 years down the lane, nobody has seen, this generation has seen, and we as youth has seen something havoc like that. People losing lives and normalizing of people losing lives, that what can be done? How can things go wrong? The first wave where people were clueless, medical expertise were clueless how to handle the situation. But the second wave was something which could have been avoided. Like the wave couldn't have been avoided, but structurally we could have done a lot of things from what I feel. A lot of systemic ways could have been there to ensure that oxygen plants are there, more facilities are there, artificial, like more isolation beds are provided, and things like that we could have done on our part. We have seen civil societies do their part. We have seen organizations, humanitarian organizations do their part, and several other things. But what lies to the basic core of it, that majority of the institutions who are actually responsible for our well-being just gave up. They just said that this is a wave and you need to find your own beds, you need to find your own ways, you need to see how you save your lives, and that's it. So the idea that human lives can be saved, the idea that human lives can be better, there can be qualitative difference in human lives, has to come from people who actually really make an impact. And that a major responsibility lies to the people who are making policies, who are sitting there having power, making policies and impacting lives of people. And there comes the idea that when we are working in education sector, we are students ourselves, what we see is deeply concerning, that how even in education, privatization has been normalized. And I'm not saying that this normalization has happened in last 2 years, 3 years, 5 years. This normalization of privatization of education or privatization of healthcare has been normalized in the past few years. There is a systemic normalization that whatever is privatized is better. We have heard this. I have growing uply heard this in families, around in small discussions, that government hospitals are not worth. Government schools are not worth. If you have to get quality education, you need to go for private education. If you need to get quality access, it's better in private education, private hospitals, private healthcare. But that's not the reality. I stay in Delhi. I've been staying in New Delhi for last 13 years. And I know for the fact that whenever there is a healthcare emergency, anything, people will only refer to Safdarjung and AIIMS, All India Institute of Medical Sciences, which is a government medical college plus hospital. And you can, when I'm sure if you all have been in Delhi, you will see that there are lines, like queues for kilometers, where people who don't have access to anything, they travel to Delhi just to get medical facility for in very minimal cost, many times for free. Why? Because they know that public healthcare is a better model. Inside our hearts, we know that public healthcare is something we can afford. So when it's happening in Andhra Pradesh, or the central government has given a direction to set up PPP model medical colleges and hospitals across in the country, out of which Andhra Pradesh, I think so, is having 17 of them. So this is a deeply concerning thing, that how everything is becoming a profit motive. Now, what is concerning for us is that how we see the system, that we are not only privatizing the medical colleges, but medical colleges also have hospitals. So eventually we privatize the hospitals. So we privatize healthcare in a way that becomes only accessible to the few. So those who have money, they can access insurances or some healthcare insurances and go to private hospitals. The majority of the sections then don't have access to better healthcare facilities. So we are saying that if you have to get better healthcare, you need to have better healthcare, then your worth is how much money you have in your pockets. It's exactly what's happening to education. So it does not matter that if I'm a good learner or I am a very good person, I can have a good cognizance. That does not matter anymore. What matters now is whether you have money. So even if you're not having talent, but you have money, you can get anything inside the system. And if you are having talent, however struggling your life is, nobody cares about you because you don't have money. So at the end, finance will set the limit inside our society, who has what and what kind of access they have. I'm saying this also from a personal experience because I come from a very lower middle class family. And if I'm standing right here, speaking in front of you, I was not this 20 years back. I come from a very small town in West Bengal where getting higher education was unimaginable. I am the first person from my family studying PhD. And it was only possible because I always studied in a government school, a government college, and government institute till date. I'm studying in JNU, and very proudly I stand here to say that my fee structure is 280 rupees till now, standing in the national capital. People wouldn't have imagined this. When I go to other students, speak to them that I'm doing my PhD and my only fees that I pay to my institute is 280 rupees, they are in shock. Because it's unimaginable to think that you're a research scholar and you're only spending 280 rupees. I get scholarship from the government. And these have been possible only because there has public model of education. I don't think so I would have been standing in front of you confidently speaking if I did not have this systemic access. I would not have been, any girl would not have been. If I'm able to stand here, it's because of the power of public education. And that is why it is very, very important for us to understand that why public form of education or healthcare is important. Because it gives you that access that no other systemic access. Second of all, what public spending are being used on inside this country has to be really thought of. So we are paying taxes, as citizens people are paying taxes, crores of taxes going from the majority of the citizens of this country. But that is not eventually being used on us, not used on the people, the youth, the students, the women. So that is a concerning thing. Where are the taxes getting used? Because I'm coming from JNU, generally JNU is infamous being told that all the taxpayers' money you people are eating. But we genuinely need to question that where are the taxpayers' money going? If it is not getting better hostels in our country, hospitals in our country, no better health centers are there. Now also villages don't have access to basic sanitation, hygiene, water. It's really shameful that in 2025, I was in Andhra Pradesh for the last 3-4 days. I was in Bihar before this. I was talking to students to a large section in districts. And you would not believe in Bihar, I was also mentioning about Bihar and UP. You can't imagine that I recently visited a college which has 14,000 students and there is not a single washroom for the female students. You would not believe it. And for me, it was not only shocking, but it was really thought-provoking that standing in 2025, what students are having to protest for is a female washroom inside a college in Bihar. And that is deeply concerning. And we are, on the other hand, making a narrative, people sitting in power, that the taxpayers' money is going wasted. Where are the taxpayers' money then going if it is not being utilized on our citizens, on our people? So that's very concerning. So when I stand here, I deeply stand in solidarity with the voices that have been raised today, that why medical facilities should not be privatized, or why medical college linked with institutes should not be privatized, and what are the impacts that they are going to deeply have. They're not only going to have deep impacts on students, majorly, that students will face the brunt of it. They have to pay management quota fees of 20 lakhs, 30 lakhs. We know all this is happening from long time. Post 1991, the liberalization process and all, we have seen how medical institutes have been commercialized, and post now we have seen that that has been rampantly happening to state colleges now, state institutes now. But what is also deeply concerning, we are seeing so much of migration of students outside, because they feel that in India, if we are having to pay 20 lakhs, 30 lakhs, 40 lakhs, let's go and study in Uzbekistan, let's study in some Central Asian nations where the cost of medical institutes are less than what we are paying in India. So that has become the thought process. Nobody is now thinking that how healthcare can be improved. And what rightly is to be discussed, that there is so much of development happening in medical sector. There is innovations happening. Then where is India leading in that innovation? Where is our medical fraternity leading in that innovation? Are we there somewhere? Whether it's about several healthcare issues, during COVID we had this discussion, or maybe during different times when there are various things happening, we keep discussing that how much our medical fraternity we are able to support. Because this support can only be possible if there is research and development also happening at the medical sector. And for that research and development, you need money. And for that money, there needs to be an investment. And for that investment, there need to be budget. And that budget has to be given by the governments. So if the government is not ready to invest in the research and development also of the medicine, then it's a really concerning thing that what we are developing. We just can't take pride on the fact that Indian studied, some medical student has gone abroad and done innovation there. We are not building human resources here to send them abroad to better the facility of US or better the facility of UK. We are building human resource to better our society, to lead that game, not to lead some other country's game. So we, as a collective, as a civil society, expertise are there. I'm no better to speak than them. They know it very well. But we have a huge potential as a country. We have a huge potential. We have seen every year lakhs of doctors passing out. But where are they? We only can better the system that we, as a policy level, we have to better that. If we have an intention to better that. And what is very deeply concerning, because from the town I come from, there is a lot of privatized medical institute cropping up. Why I say this? Because there have been juniors of mine who are taking medical seats at the cost of 1 crore. You wouldn't believe. I come from a very small town, and 1 crore, 90 lakhs, 80 lakhs, medical seats been given off to people who have money. Now, can you imagine those students who are studying with 1 crore? Of course, they are not studying. Any middle class family, it's not possible to pay off 90 lakhs, 1 crore. We all know that. Not even 20, 25 lakhs. You have to sell off all your land. You have to sell off all resources you have. So if somebody is paying 20 lakhs, investing on one child, 20 lakhs, 30 lakhs for a management quota, then we know that that person has to pay back. And if they have to pay back after studying MBBS for 5 years, and then again they need to think of doing MD also and other courses, we know what's going on in the system. So I want to end with that, and I stand in solidarity with your demand of strengthening the public model of healthcare. Thank you so much.